Hey.
Hi, my name is Roger Bannister, and today we're going to look at taping for posture using RockTape's Big Daddy tape, or 10 centimeters, and also the 5 centimeters. The postural taping, basically, we're going to apply between the mid-scapular area, and then we're also going to do two stabilizing strips coming from the left scapula, coming down to the right lower quadrant, and then from the right side down to the left. So let's start with the Bigotech. The idea behind this one is that because we're going to naturally put a bit of stretch on this tape, we're going to put the landmark from the mid-scapular to mid-scapular and cut that tape. And what we're going to do, we're going to round both ends. And the same on this side. And then that will be the tape now prepared. I'm actually going to split the tape in the centre and peel it back like you would a plaster, one end and the other end. Try not to touch the acrylic adhesive if that's possible. And then what I'm going to do is, can I get you just to sit straight there? Retract the shoulders a little bit, not too much, about there will be okay. Apply that to the central spine, and then I'm going to stick that down. I'm just going to put my hand there and stick it down one side. So the first 3 or 4 inches, you've got no stretch on that. Then we're going to do one side at a time. So peel this back. And then what we're going to do is lock it down. And then 100% stretch, 50%. So between 50 and 75, so that's 150. And then lay that down. And then there's no stretch at the end of the tape. And do the same on this side. So lock it down. So 100. 50 to 75, and lay that down. And that should become equal to the lateral sides, just past the lateral border of the scapula. Can you feel that tape? If you just let the shoulders round, can you feel it supplied?
Yeah, definitely.
So that's part one done. We can actually leave it like that. But what I'm going to do now is just sit a little taller, and then using the 5 centimeter tape, I'm just going to take that measurement, and then we're going to do 2 strips. So we'll do 1 strip, 2 strips, then go around the ends, and the same on this side. So it doesn't take you long, and I like to demonstrate this with the patient and teach them exactly the length of the tape and why we do it. Now this time you're going to split the first square, so there's no stretch on the end, and apply that in the supraclavicular fossa, so just above the clavicle, where the traps inserts. And then just hold your shoulders in that position, not too much. Pull it so it lifts, peel it back to the first square, and apply about 50 to 75% stretch from the left side, crossing the mid, and then finish on that right lower inferior aspect. And the same again. Apply this, so try not to touch the tape if you can help it, and allow that to sit over the supraclavicular fossa. Pull it so it lifts, peel it back, and then 100%, 50 to 75, cross over, no stretch at the end. Then what we can do just for a few seconds is heat activate the acrylic. And then just have a feel of that, Nick, see how does it feel? So you feel like you're stable through that mid-scapular area?
Yeah, I feel like I've got a nice bit of slack onto the upper back muscles. Okay,
that's good. So there you have postural taping used in RockTape, and I am John Gibbons. For further information, look at www.johngibbonsbodymaster.co.uk for course.